Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. And yourself?
I'm great, but I'm also living it up.
That's awesome. Well, we want our listeners to live it up, so you can call the program and talk to Dr. Darrow all hour long about your musculoskeletal or orthopedic pain. And when you do, you get a free book, Dr. Darrow's latest, at 866-870-5752. And the book is Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with 264 scientific studies. The foreword is written by Suzanne Summers, who has her new book out as well. And in her book, she talks about Dr. Darrow. So that number again, call the show right now, get your free book. It's 866-870-5752. What do you think?
Nita, have you ever looked at the back of the book? Do you have one in front of you?
Oh, I just, I left it in the car today. Of all days, you would ask me.
Oh. Well, in the back it says, Dr. Marc Darrow has been my health coach for many years. His recommendations for nutrition, hormone therapy, weight training have all been tested, tried, and true. Through his guidance, I've successfully accomplished my fat loss and muscle gain goals. It makes sense to regenerate tissue rather than cut it out. Stem cells are the way. Now, do you remember who said that?
Yeah, Suzanne Summers said that.
No. Good try, Anita.
Thank you.
Believe it or not, Dr. Dre.
Oh, that's right. I forgot. That's right.
He is one of the most fascinating men I've ever met. Dr. Dre, I love you. And your wife, Nicole, is amazing, too. Suzanne Summers, of course, you're amazing. You're an advocate for all of us doctors who do natural medicine and try to stay away from traditional medicine, although we have to know traditional medicine. In the work that I do, which is regenerative medicine, it's still not quite on the forefront of orthopedics because surgery is where all the money is made, and hospitals would go bankrupt if they didn't have surgeries to keep them going. So what this is all about is something really cool. I'm going to actually start out with a question here until we get some callers.
Okay.
And you can just grab me if I'm talking too much.
Do you want to give
this.
the website also?
Yeah, I'm going to do the whole thing here.
Okay.
You can watch me do these injection procedures at www.lastemcells.com. I'll repeat it for you while you grab your pen. It's www.lastemcells.com. That's my website. It's got endless pages of how you can heal naturally and regenerate the body instead of having surgery to cut tissue out and destabilize the body and cause all kinds of havoc, what we call sequelae, things like infections and one leg longer than the other and stuff like that. So it's what I've been doing with myself on my body for almost 25 years, injecting myself. And today we use platelets from the blood. Platelets have a lot of healing cells in them and also stem cells from bone marrow. Bone marrow also has platelets in it, but it is, it's like, I always tell people when they come and they go, what should I do? And I'll go, if you're in a fight, do you want one sniper or two snipers? And they go, well, I want two snipers. So I go, well, then bone marrow is how you do that because it's got the stem cells and the platelets in it, rather than just doing platelets alone, although platelets alone are still very, very good. So this person wrote in and said, by the way, the phone number, so you can talk to me right now, is 800-300-9300. I'll repeat that. It's 800-300-9300. Actually, that's my office number. You can call there, and there are people there that can answer all your questions if we don't get to them here. So I'm going to go to another question here, if you guys don't mind.
Sure.
So let's see here. This is a person that wrote an email. It said, I have avascular necrosis. That means that bone is dying. Avascular means the blood supply is cut off. My doctor scheduled a hip replacement surgery for December. Instead, I am going to fly to Costa Rica and have umbilical stem cells and cartilage injected into both hips. I will let you know how it turns out in 3 months. Excellent. I would appreciate that, and I would love to find out how other doctors are doing. I'm not sure why going out of the country is necessary. We are doing these procedures right here in the United States. The reason could be we're not allowed to do embryonic, stem cells here. We're not allowed to take stem cells from babies, newborn babies, because that means that the baby has died. And in Eastern Europe, it's a form of birth control where they do abortions. And back in the days of George Bush, that was stopped here. Okay, so a lot of doctors do it out of the country, but it's not something that I am in favor of. I'm not interested in killing babies or anybody else to get the cells. You can use umbilical cord stem cells. That comes from the umbilical cord. The babies are healthy and the moms are healthy, and that helps heal very much also. So we'll see what happens with this person. I'm not going to give his name out, but thank you very much for sending in that question. And it is not necessary to leave the country to do stem cells here now, as long as they're not from a newborn baby. Here's another question. Options to knee replacement. Let's see what this says here. I would like very much to speak with an individual, I'm an individual, regarding knee replacement treatment or any potential options at this time. So the answer to that is I see a lot of people with knee replacements that didn't work. And sometimes a joint is replaced. I can talk about this for the knee, the shoulder, the hip, toes, fingers, whatever it is, elbows. And it's a great idea in terms of the technology of it. It's a great idea thinking about it. But unfortunately, I get all the people that come in where it didn't work. So I have a very jaundiced eye about getting joint replacements. I've only sent maybe 2 people for a joint replacement in my 23 years of doing regenerative medicine. And one was a crushed knee. A person had a forklift injury. And the other one was a hip that was so arthritic the person couldn't even walk and was in terrible pain. They couldn't move that joint at all. But most people I see that are ready to have a knee replacement like this person don't need it, in my opinion, okay? I know a lot of orthopedic doctors, orthopods, will argue with me about that, and that's fine. We all have the right to our own opinion. I'm not saying my opinion is better than anyone else's. I'm just saying that's my opinion. I see very few people who come to me ready for a joint replacement that, in my opinion, need it. And they don't end up getting it after we treat them with bone marrow or platelets from the blood. So that's my experience. Every doctor has their own experience. Every individual person, every human has their own experience, and act out from that to do the best I think that they can. I believe everybody does the best they can with what they know, and some of those things aren't the greatest. And for the people that are doing things that are not the greatest, I do my best to stay away from them and stick with the people that are doing things that are good for others. And that's what I hope I am doing.
Absolutely.
So knee replacements, I'm not for it. I can tell you a story of a guy who came in, and he came in for pain in his right knee. He was scheduled for a knee replacement, and while I was examining him, because I always do both sides of the body to see what's going on, the right knee that he was going to have a knee replacement on, to me, was not bad at all. And I looked with an ultrasound. There was some fluid in it. It looked pretty good. There was cartilage in there, but he was having pain. So his his orthopedic surgeon said he needed a knee replacement. So he came to me because someone forced him to, who had seen me and had great results. So I examined the knee and I said, that's a really good knee. I don't know why anyone would want to amputate the bones and put a prosthesis in there. And he said, tell me more about it. I said, let me examine your left knee first. So I examined his left knee and it wasn't moving. And I said, something happened to this knee that was not very good, because that knee is not moving. I could move it a little bit, but it made a lot of noise. And he said, I had a knee replacement on the left knee. It didn't work out. So I've seen too many things like that. A man came in with a shoulder replacement. He couldn't move his arm. I'm not saying all of these fail. I'm just saying the failures end up coming to me, and there are certainly enough of them that it's not something I want to send people to have. Very simple. So I'm going to give out the phone number again, Nita, if you don't mind, to the studio. It's 866. That's 866-870-5752. I'll repeat it, 866-870-5752. I would love to hear from you. I know a lot of you who are listening have been told that they needed a surgery, didn't do it, and are doing better now than they were a long time ago. And that's my favorite thing, when a person just heals by nature. Anything natural, I'm in favor of. Anything that's high-tech, I'm a little nervous about. If you want to call my office later, there are people, but you can actually call right now. The number to the office is 800-300-9300. That's 800-300-9300. So I'm going to go to another question here.
Can I just let people know about the free book?
Absolutely. Yes, you get a free book called Stem Cell and Platelet Therapy, Regenerate, Don't Operate, if you call me right now. So,
and the number again is 866-870-5752, 866-870-5752. It's a great book. I love it.
By the way, this I know you have one in the car that you keep.
Actually, two.
I know Nita is a good referral source. She hands my books out to her friends who come in and see me, and her patients. This book has 256 studies. It took me 5 years to put together, and the studies can tell you, they're all in the back here. They can tell you why not to get surgery. These surgeries fail way too often when it's for the musculoskeletal system. And don't get me wrong, I do love surgeons because we need them. It's very hard work that they do. I just don't like these surgeries for meniscal tears, rotator cuff tears, joint replacements, and all those kind of things. They are done way too often. Okay, let's go to back pain. You ready, Nita?
Ready. Let's hear it.
Let's see what's up here. Okay. Actually, this is a response to someone who got my newsletter. And if you go to the website, there's a spot on every page where you can email me and talk to me. And there's a spot where you can ask to be on our newsletter list. We send newsletters every day about different parts of the body. And part of it is we do the vampire facelift that's included here. And that is very similar to what I do for the musculoskeletal system, but it's actually for the face to make you look better. And we use cells from the body, platelets or stem cells, and put them into the face to regrow the collagen in the face. Because as we age, not only do we get shorter, because the discs in our back seem to dry out, but the faces dry out, the collagen dries out, and we start getting gaunt looking. It also mentions that we do PRP for hair loss and restoring the hair by putting platelets or stem cells into the scalp. So this person writes, I have had back pain for 25 years. Whoa. And I heard your radio show, and I'm very interested in seeing what alternatives are. My doctor has told me that I need a back surgery to repair a herniated disc, but I don't think that's the problem because I don't have any pain down my legs. This guy is smart. That's pretty accurate. He says, I've localized low back pain, and I've heard your show, and you've talked about how in that situation, surgery is not the answer, and it probably will not fix the situation. So I'm interested to find out whether PRP or bone marrow stem cells would be the answer. So I talk a lot about this. I have to do an examination with everyone first. I really can't tell you on the radio if I can help you or not. You can have things that you tell me that sound like I can help you, but until I actually touch the body, it's very, very difficult to know where the pain is being generated from. So the big failure we have in traditional medicine today is that people get an MRI, X-ray, CT scan, and then from that, the doctor tells you where your pain is coming from. That is not accurate. I am sorry, folks. That's not telling you where the pain is coming from. That's telling you where there is an anatomical deficiency. That's different than pain. We all have anatomical deficiencies, but a lot of us don't have pain. Even people without pain have anatomical deficiencies. If we ever scan an entire body, we're going to find all kinds of goodies there that don't look right. Okay? That doesn't mean you have pain. So be very careful if you have pain and go to a doctor and they get an MRI, CT scan, or an X-ray showing that you have something terrible, but it's not the issue. Okay? We have a lot of things that are not the issue that don't cause us pain. So with pain issues, I need to examine a person. I need to move them around, elicit the pain, touch the area, find out where it's coming from, and then I can inject the area with stem cells, platelets, and actually heal it up. So many people come to me who have been to another doctor who did one injection, let's say the shoulder, and the shoulder is super complex. You can't do one injection and get a success out of it because you're going to inject an area that may or may not be the pain generator. If it's not the pain generator, you miss the area. Hey, there's someone waiting for us who's got a shoulder issue.
That's hilarious.
Yeah, it is funny. Hey, Mark, it's Dr. Marc Darrow. We have the same name except we spell it differently. So you have shoulder pain. How long has it been there for?
Well, I'm actually an existing patient.
Oh, okay. Oh, wait, I know you. I can tell by your voice. Yeah, this guy, Mark, is one of the funniest guys on the planet. We all laugh hysterically when he comes in the office. Mark, how are you?
I'm doing good.
Good. Great to hear your voice, man. What's going on with you?
Oh, well, haven't been in to see you for a little bit because I've been busy, but I just thought I'd call in because you were talking about shoulders, and I had rotator cuff tear last year, and it's taken a while, but it's doing a lot better. I'm probably up to about 90% on my shoulder, and didn't have any surgery. Well,
God bless you, man. I really appreciate the call. I know we've worked on you quite a bit, and you've done really, really, really super well, and it's a pleasure to have you around. I'm glad you're not having big problems anymore, but I do miss you.
I'll be in to see you soon.
If you want to do that, just make a late appointment. I'll take you out to dinner afterwards.
Okay.
That sounds like fun. Don't say no to that one, Mark.
No, I wouldn't say no to that.
Okay.
Yeah, we'll have some fun. I love being with Mark because he's nonstop jokes. He knows more jokes than anybody I've ever met in my entire life. Mark, I appreciate your call, and happy holidays to you, and God bless you again.
Shana Tova.
Thank you, Mark. Take care. Oh, I should have let him tell us a joke.
No, you can't let him do that because he won't stop.
Oh.
That's the only issue. His jokes are long.
Oh, okay.
But I have short jokes. Why don't melons get married?
Why don't melons get married? There's too much water between them?
Well, that would be good because they can't elope.
That's a good one.
What did the football coach say to the broken vending machine? Nita, you'll never get this.
I probably never will get that one. I'm not going to.
Give me my quarterback.
Oh, that is a good one. That is a good one. Okay.
So let me go to another question.
Well, wait.
here.
Let me give the phone number again.
Okay.
866-870-5752. And you want to call and get your free book. It's called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate, because it's got 264 scientific studies, and lots of people whine about how, well, I never heard of this, and where's the studies, and where's the research? Well, here it is, just for you, 866-870-5752.
All right, here's a question that came in from my website.
Okay.
I've had 2 lower back surgeries in the same area, L4 or 5, and spinal fluid sac tore, that's the dura, and left me with severe nerve damage. Now my nerves are fused together in that area. Could stem cell injections help me? Whoa, it's a big question I don't have the answer to. The reason is because I don't inject stem cells for that issue. I do them for orthopedics, and this is more for neurology. I do know someone, if this person is listening, that might be able to help you who does inject the spinal cord and has had pretty good success with people who have been paralyzed. So if you want to email me, go to the website, www.lastemcells.com. That's lastemcells.com. Every page has a spot to email me, and I'll do that privately with you, okay? Because I don't want to give out his name over the radio.
That sounds good.
We're going to the break.
This time just flies on by.
Stick with us, folks. We love you.
We do. You're listening to Living Pain Free with Dr. Marc Darrow. Grab a pen or a pencil. Write down this important information coming your way. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.